Because if you're taking amlodipine, losartan, or lisinopril, there's a real chance that one symptom you've been brushing off as age, stress, bad sleep, or just a rough week is actually your body trying to tell you something your prescription label never fully explained. And that's the part that worries me, because people don't usually get hurt by these medications when they're prescribed wrong. They get hurt when they don't understand what the medication is actually doing inside them. And they miss the clues until something serious happens. Before we get into it, hit subscribe so you don't miss the next video. These are the kinds of details that quietly protect you long after the appointment is over. A lot of you have been asking me to talk more about blood pressure medication, and honestly, the response to my last video on this topic completely surprised me. So many of you wrote in, shared your own stories, asked follow-up questions I hadn't even thought of. That tells me this is something people are genuinely worried about and don't have enough clear answers for. So today, I want to go even deeper, because if you're taking amlodipine, losartan, or lisinopril, there's more you deserve to know, and that's exactly what we're covering in this video. If you've been told to take amlodipine, losartan, or lisinopril to bring your blood pressure down, there are 11 things you deserve to understand clearly. Not because your doctor is hiding anything from you, but because most appointments are short, most explanations are rushed, and most people walk out with a bottle in their hand and only half the picture. By the end of this video, you'll know which side effects are common, which ones are dangerous, and which ones sound harmless but absolutely are not, and why the most important truth of all has nothing to do with the number on your blood pressure monitor, and everything to do with whether you can actually stay on the medication safely long term. A lot of you have been asking me to talk more about blood pressure medication, and honestly, the response to my last video on this topic completely surprised me. So many of you wrote in, shared your own stories, asked follow-up questions I hadn't even thought of. That tells me this is something people are genuinely worried about and don't have enough clear answers for. So today, I want to go even deeper, because if you're taking amlodipine, losartan, or lisinopril, there's more you deserve to know. And that's exactly what we're covering in this video. Let me start with Margaret, because her story explains why this conversation matters so much. Margaret was 73, careful, the kind of patient every doctor hopes for. She took her medicine exactly as prescribed, kept every follow-up, never missed a dose. Her blood pressure looked beautiful on paper. Everything seemed perfect. But 2 months later, she was telling me her shoes didn't fit anymore. Her ankles puffed up every evening, and by bedtime, her legs felt strangely heavy. She assumed she was gaining weight. Her son worried it was her heart. Margaret was scared. And what nobody had fully explained to her was that the medication doing exactly what it should for her blood pressure was also causing a very specific side effect that can trick people into thinking something else entirely is wrong. And that brings us to number 11, the first thing most appointments don't leave enough time to spell out. These 3 medications are not the same pill wearing 3 different labels. Amlodipine is a calcium channel blocker. Losartan is an ARB. Lisinopril is an ACE inhibitor. They all lower blood pressure, yes, but through completely different pathways, which means completely different patterns of side effects. If you don't understand that, you'll misread what your body is telling you. You'll assume all blood pressure medicine behaves the same way. It doesn't. Amlodipine relaxes blood vessels in a way that commonly causes swelling in the lower legs. Lisinopril is well known for triggering a dry cough. Losartan is often the medication doctors switch to when someone can't tolerate that cough. Same goal, different pathway, different clues. Here's why that matters more than people realize. If you start coughing on lisinopril and assume every blood pressure medicine will do the same thing, you might quit treatment altogether. If you swell on amlodipine and assume your heart is failing, you might panic for nothing. If you feel perfectly fine on losartan and assume there's nothing to monitor, you might miss a potassium problem building quietly underneath the surface. The first hidden truth is simple but powerful. The name on the bottle tells you the class, and the class tells you the pattern. Once you understand the pattern, you stop being blindsided by your own body, and once you stop being blindsided, you make better decisions faster. Decisions that can keep a side effect from turning into an emergency. Number 10 is the one Margaret was living through without realizing it. Amlodipine can cause swelling in the ankles and legs, and it's one of the most misunderstood side effects in blood pressure care. People assume it's too much salt or weak kidneys holding onto water or just getting less active. But with amlodipine, the swelling usually happens because the small arteries relax more than the veins do. Blood flows into the legs easily, but doesn't flow back out as easily. Pressure builds in the tiny vessels, and fluid slips into the tissue around the ankles and feet. That's why people say, "I'm fine in the morning, but by evening, my socks leave marks." Let me tell you about Walter. Walter was 75, and every afternoon his ankles looked bigger than they had at breakfast. He chalked it up to getting older. Then he started propping his legs up at night and noticed the swelling eased only to creep back the next day. He never connected it to the amlodipine he'd started 7 weeks earlier. What made this risky wasn't the swelling itself. It was the quiet around it. He didn't want to bother anyone. He kept taking the pill, kept feeling more uncomfortable, and eventually started skipping doses on days he wanted to go out because he was self-conscious about how his legs looked. That's exactly how a manageable side effect turns into uncontrolled blood pressure. The swelling doesn't necessarily mean the drug is wrong forever, but it absolutely means the conversation needs to happen. Number 9 is something people brush off for far too long. Lisinopril can cause a dry, nagging, persistent cough, and what often isn't emphasized enough is that this cough doesn't always start right away. Sometimes it shows up within days, sometimes within a couple of weeks, and sometimes not until months later, which is exactly why people miss the connection. They blame allergies, dust, reflux, a lingering cold, or dry air. The cough usually feels scratchy and stubborn, not wet, not dramatic, just relentless. And because it tends to get worse at night, people assume their lungs are the problem, when the real cause is sitting quietly in their pill organizer every morning. Diane learned this the hard way. She was 70. And 5 months after starting lisinopril, she developed a tickle in her throat that wouldn't quit. Then came the nighttime coughing fits. Her sleep fell apart. Her energy dropped. She assumed it was just age, or maybe her old reflux flaring up again. She tried lozenges, switched detergents, even replaced her air filter. Nothing helped. When I asked when the cough actually started relative to her medication, she went quiet. Nobody had ever told her the lisinopril cough could show up late. Once I explained it, everything clicked. This matters because plenty of people quietly suffer through that cough for months, and many eventually stop the medication on their own without telling a soul, which is exactly what we don't want. But there's something far more important hiding behind this, and I need you to hear it clearly. A dry cough on lisinopril is not the same thing as a dangerous allergic emergency. The symptom that should genuinely alarm you is swelling of the lips, tongue, face, or throat, especially if breathing or swallowing becomes difficult. That is not a wait and see situation. That is not a call on Monday situation. That is emergency care immediately. AC inhibitors like lisinopril can, in rare cases, cause angioedema, and it can turn dangerous very fast. ABs like Losartan have very rarely been linked to something similar, but the classic concern sits with ACE inhibitors. So, hear me clearly. If it's a cough, don't panic. If it's tongue or throat swelling, move fast. Number 8 is one of the most dangerous truths in this entire video, and it hides in plain sight in the grocery aisle. If you take Losartan or lisinopril, potassium matters. Most people hear that and think, I don't take potassium pills, so I'm fine. Not necessarily, because potassium shows up far beyond a supplement bottle. It's in salt substitutes, heart-healthy seasoning blends, electrolyte powders, some meal replacement drinks, and over-the-counter products people reach for without a second thought. Both Losartan and lisinopril can raise potassium levels. High potassium becomes dangerous because it affects your heart's electrical rhythm. It doesn't always announce itself loudly. It can show up as weakness, cramping, tingling fatigue, palpitations, or sometimes barely any symptoms at all. Let me tell you about Harold. Harold was 76 and trying so hard to do the right thing. He cut back on sodium, started reading labels, and proudly switched to a salt substitute because he thought it was exactly what his heart needed. What he didn't realize was that most salt substitutes simply trade sodium for potassium. So now he was on Losartan, which can raise potassium on its own, while seasoning every meal with even more of it. He started feeling weak, a little off, then noticed his chest skipping beats now and then. By the time his labs were checked, his potassium had climbed high enough to need immediate attention. The tragedy is that Harold wasn't careless. He was trying to follow the rules, trying to be the good patient. Nobody had simply connected the dots for him, and that gap in education is exactly where people get hurt. Number 7 is the truth about kidney numbers, and it confuses people so badly that they sometimes stop a medication right when it may be doing something protective. Losartan and Lisinopril aren't only blood pressure drugs. In the right person, they can also protect the kidneys and the heart over time. But when you first start them, or your dose goes up, blood work may show a small change, a rise in creatinine, a dip in eGFR. To many patients, that reads as proof the medicine is damaging the kidneys. Sometimes that's a real concern, but sometimes a small early shift is expected because these medications change the pressure dynamics inside the kidney's own filtering system. That's why the blood test matters and why guessing is so risky. Patricia nearly made that mistake. She was 72 with both high blood pressure and early kidney disease. Her doctor started her on Lisinopril specifically because it could help protect her kidneys long term. A couple of weeks later, her labs shifted slightly. She saw the results in her patient portal before anyone called, panicked, and decided the medicine must be hurting her. She was one click away from stopping it herself. That evening when we talked, I explained that the real question isn't just whether the number moved. The real question is how much it moved, what the trend looks like, and what else is happening in the body. A mild expected supervised change is a very different thing from a dangerous decline. That's why lab follow-up isn't optional. It's part of the treatment itself because these drugs are powerful and useful only when they're monitored intelligently. And this leads straight into number 6, one of the most overlooked dangers in older adults. Dehydration changes everything. If you're taking Lisinopril, Losartan, or Amlodipine and then you come down with vomiting, diarrhea, a stomach bug, poor appetite, or heavy sweating in hot weather, the medication that helped you yesterday can hit you very differently today. Your blood pressure can drop too low. Your kidneys can come under strain. You can feel dizzy, weak, or faint, and in some cases slide into acute kidney trouble faster than you'd expect. The medication didn't suddenly turn dangerous. Your body's fluid balance changed, and the same dose is now acting in a completely different internal environment. This is one of the biggest nobody told me moments in blood pressure care because people keep taking their usual pills straight through illnesses that dramatically change their hydration. Eugene was 79 when this caught up with him. He had a nasty stomach virus, couldn't keep food down, and still took his usual Amlodipine every morning because he was proud he never missed a dose. That night he stood up from the couch, the room spun, and he nearly went down. In the emergency room, the issue wasn't that Amlodipine was a bad drug. The issue was that his body was depleted. He'd lost fluids, his blood pressure had bottomed out, and his kidneys were under stress. What he needed wasn't blind obedience to the pill bottle. He needed a plan for sick days, to know when illness changes the rules, and when to call for guidance instead of pushing through. That kind of practical advice isn't dramatic, but it prevents real suffering, and it pushes back against the dangerous idea that medication should be taken no matter what the body is going through. Number 5 is the hidden trap sitting in millions of medicine cabinets, and at first glance it has nothing to do with prescriptions at all. Ibuprofen, naproxen, just for my back, just for my knee, just for the weekend in the garden. If you're taking Lisinopril or Losartan, especially alongside a diuretic or water pill, regular use of certain anti-inflammatory pain relievers can create a perfect storm for your kidneys. This interaction shocks people because every piece feels harmless on its own. A blood pressure pill, a pain reliever, maybe a water pill. Nothing about it sounds dangerous, but together, in the wrong situation, especially with dehydration, they can reduce blood flow to the kidneys and raise the risk of kidney injury. Most people never mention the counter pain reliever to their doctor because they don't even think of it as real medicine, just something from the drugstore shelf. Nancy did exactly that. She was 74, took Losartan for her blood pressure and a water pill for ankle swelling, and used ibuprofen several times a week for arthritis in her hands. She thought she was managing everything beautifully. Then her labs worsened, her blood pressure turned erratic, and everyone scrambled to figure out what had changed. It wasn't a mystery. It was the interaction. Once the daily anti-inflammatory was removed, safer options were reviewed, and monitoring was tightened, things improved. But here's what I need you to take from this. A lot of medication danger doesn't come from rare side effects buried in tiny print. It comes from common combinations nobody ever sits down to review. If you take Losartan or Lisinopril, an over-the-counter pain reliever is not a casual throwaway topic. It's a real safety conversation, and it deserves one. Number 4 is the side effect people normalize right up until it becomes a fall. Dizziness, lightheadedness, that woozy moment when you stand up too fast, the weak feeling after the first few doses. With all 3 of these medications, especially when starting them or raising the dose, your body needs time to adjust to a lower blood pressure. That can mean dizziness, particularly moving from lying down to standing. People laugh it off. I just got up too quickly. Maybe, but in older adults, a few seconds of dizziness can become a fractured wrist, a head injury, a broken hip. And here's what people don't always realize. Sometimes dizziness means the medication is doing its job a little too aggressively for your current body, hydration, or combination of medications. Vincent was 81 and proud of his independence. He lived alone, moved carefully, hated asking for help. 2 days after his amlodipine dose was increased, he stood up in the bathroom in the middle of the night and felt the floor tilt. He grabbed the towel rail just in time. He didn't fall, but it shook him badly. When I asked whether anyone had told him to rise slowly, sit on the edge of the bed first, and watch for ongoing weakness or near fainting, he shook his head. He'd been told the medication might lower his pressure. He hadn't been told what that could actually feel like alone in a dark house at 200 in the morning. That's the difference between prescribing a drug and preparing a person for it. Mild dizziness may settle on its own. Fainting is never something to ignore, and repeated dizziness is never something to quietly endure. Now to number 3, and this is where a lot of careful, intelligent people accidentally sabotage their own treatment. They look at one blood pressure reading, see a high number, and decide the medication has failed. Or they see one low number and decide it's too strong. That isn't how blood pressure works. Blood pressure moves with sleep, pain, stress, talking, posture, meals, caffeine, even anxiety about the reading itself. A single number isn't a verdict. It's a snapshot. What matters is the pattern. What matters is consistency over time. Not one startled glance at the monitor on a Tuesday morning after bad sleep and a rushed trip to the bathroom. Amlodipine, Losartan, and Lisinopril should all be judged by trends, not by panic. And now we arrive at number 1, the most important thing most appointments never quite say out loud. The best blood pressure medication isn't the one that gives you the prettiest number for 3 weeks. It's the one you can stay on safely, consistently, and intelligently because it actually fits your body, your symptoms, your other conditions, your labs, and your life. That's the truth people miss. A medication can look like a success on paper while quietly failing in real life because you hate how it makes you feel, you don't understand its warning signs, or you've started avoiding it without telling anyone. Amlodipine may work beautifully for one person and cause miserable swelling in another. Lisinopril may protect the kidneys and control pressure wonderfully, while a dry cough wrecks someone's sleep. Losartan may be a great alternative, but it still demands respect for potassium, kidneys, and hydration. Let me tell you about Ruth because her story pulls all of this together. Ruth was 71 and had excellent blood pressure numbers on Lisinopril. Any doctor glancing at her chart would have smiled, but Ruth was coughing every night, barely sleeping, and starting to dread the pill in her hand each morning. She didn't mention it to anyone because she assumed the answer would be, well, you need it, so you'll just have to live with it. That assumption is exactly where patients quietly disappear. First, they resent the medication. Then they start forgetting it on purpose. Then they stop it altogether. Then the blood pressure climbs back up and everyone acts surprised. Ruth didn't need a lecture. She needed a medication plan that actually fit her body. Once the cough was recognized as likely medication-related, her doctor was able to reassess and adjust. That's good care, not push through at all costs, not suffer in silence because the number on the chart looks nice. Real care means the person matters just as much as the pressure reading. This is what doesn't always get said clearly enough. Side effects aren't personal weakness. They're data. Swelling is data. Cough is data. Dizziness is data. Weakness after dehydration is data. A strange pounding heartbeat, ongoing lightheadedness, worsening fatigue, cramping when potassium is off. These are all pieces of information. Your job isn't to diagnose yourself. Your job is to the pattern and report it. Too many people think being a good patient means never complaining. That's not true at all. A good patient pays attention. A good patient speaks up early. A good patient doesn't wait until their throat is swelling, their kidneys are straining, or their blood pressure is back out of control because they quietly stopped their medicine 3 weeks ago without telling a soul. Silence isn't strength here. Silence is risk, and risk grows in the dark. So here's the practical framework I want you to walk away with every time you take Amlodipine, Lisinopril, or Losartan. If you take Amlodipine, watch for ankle swelling, flushing headaches, dizziness, and that heavy leg feeling by evening. If you take Lisinopril, watch for a persistent dry cough, dizziness, and any swelling of the lips, tongue, or throat. Trejo snorts at trot. If you take Losartan, watch for dizziness, weakness, dehydration during illness, and signs that potassium may be drifting too high, muscle weakness, cramping, tingling, or an irregular heartbeat. With Losartan and Lisinopril, especially, blood tests matter. With all three, consistency matters. And with every single one of them, a symptom you can't explain is worth a phone call. You don't need certainty to reach out, just a pattern that concerns you. I also want you to walk away from this without unnecessary fear. Not every side effect means catastrophe. A mild headache when starting Amlodipine may fade. Mild dizziness when your blood pressure first comes down may settle as your body adjusts. A dry cough on Lisinopril can be annoying without being dangerous, but not every side effect should be quietly endured forever either. There's a real difference between this may improve in a few days and this is taking over your quality of life, and people blur that line constantly, either panicking over something manageable or minimizing something serious. The answer isn't panic, and it isn't denial. The answer is understanding, knowing what class of drug you're on, how it tends to behave, and which red flags cross the line from nuisance to emergency. Think about how many people live with their blood pressure medication in a fog of half knowledge. They know the name, they know the dose, they know they have to take it, but they don't know why their ankles swelled, why the cough started, why their labs shifted, why their doctor asked about ibuprofen, why dehydration suddenly mattered, or why a salt substitute could turn dangerous. That fog breeds fear, and fear breeds bad decisions. The moment you understand the mechanism, most of that fear falls away. You stop assuming every symptom is the worst case scenario, and you stop ignoring the ones that genuinely matter. That balance, not ignorance, not obsession, but understanding is where safety actually lives, and once you understand, you become much harder to harm because you stop being a passive bystander with powerful medication in your hands. If this helped you, share it with someone you know who's taking blood pressure medication. There's a chance they need this too. And I'll see you in the next video where we'll keep working through the health truths that matter most before they ever become the emergencies nobody saw coming. Thanks for watching.